Hello, this is Dr. Marcelo Kugelmas. On behalf of the Chronic Liver Disease Foundation, I'd like to thank Madrigal Pharmaceuticals for their support in bringing you this educational content.
Well, welcome. I'm Dr. Kimberly Brown. I'm the Associate Medical Director for Liver Transplantation at Henry Ford Hospital in Detroit. And I'd like to talk a little bit about Resmetirom today, both the clinical profile of who should be treated, as well as the dosing of the medication, what some of the things that we should be looking for as we start to treat patients. So as you know, resmetirom is a THR beta agonist that works primarily in the liver to decrease triglycerides. The indication is clear. It is for patients with a diagnosis of MASH who have moderate to advanced fibrosis, either F2 or F3, and to be used in conjunction with diet and exercise. So that is the indication and the patient population in whom we should use it. I am often asked whether a patient who has F4 disease or cirrhosis can use resmetirom. This has not been approved for this indication yet, although studies are ongoing in patients who have more advanced liver disease, such as cirrhosis. But those patients were excluded from the clinical trial. So really identifying the patient with moderate to advanced fibrosis, F2 or F3. So why do we select that patient population? Well, as you know, patients who have advancing fibrosis are at highest risk of progressive disease over time to the development of cirrhosis. And once obviously you have cirrhosis, then you have increased risk of liver cancer, liver failure, need for transplantation. So really identifying that patient with moderate to advanced fibrosis, hoping to intervene and decrease that progressive nature of disease, and hoping to decrease the opportunity for that patient to develop further advanced liver disease. So when we use this medication, we've identified the patient with F2 or F3 disease. Some of the questions that I'm often asked is because this is a thyroid hormone beta receptor agonist, whether patients who have thyroid disease can be placed on the medication. The answer is yes. There were patients who were on thyroid medication in the clinical trial, but there were no untoward effects in these individuals. Just to recall, THR beta receptor is primarily found in the liver, which is where the medication acts, and THR alpha receptors are primarily seen outside of the liver. Another question I'm asked is whether patients who are currently receiving GLP-1s can receive the medication. Again, about 14% of patients were on GLP-1s. The requirement in this study was that patients had to be on a stable dose of medication for a period prior to entry into the study. But it's important to note, too, that those individuals still qualified for the study. So even though they were on GLP-1s, they continued to have F2, F3 fibrosis and indications for the therapy. So GLP-1 efficacy and safety in those patients who were on GLP-1s was similar to the remainder of the patients in the clinical study. They didn't respond better or worse. They responded in a similar fashion. So we've identified the patient who is appropriate to treat. We've looked at some of the contraindications, such as cirrhosis. And then the question is how this medication is dosed. So there are actually 3 doses. When you look at the PDR, there are 3 doses that you can see, the 100 milligram, the 80 milligram, and the 60 milligram. So let's talk that through. So the 2 medications dosing that you would use in an individual is the 80 milligram or the 100 milligram. And this is taken once a day. And the dose is really dependent on the weight of the patient. So if you have a patient in front of you who weighs 100 kilograms or more, 220 pounds, you would choose the 100 milligram dose. And if you have a patient who weighs less than that, it is the 80 milligram dose. So where does the 60 milligram dose come in? So if you look at the drug-drug interactions for this medication, you can see that certain medications are contraindicated given the mechanism of action of the drug. So certain drugs that are strong, very strong CYP2C8 inhibitors, a very common medication that you may be aware of would be gemfibrozil. the medication would be contraindicated in conjunction with that medication. But it is in patient population who perhaps has a moderate inhibitory factor, such as Plavix. That may be another medication that you would commonly see. It would be in that patient where you would dose reduce the resmetirom. So if the patient was on 100 milligrams, you would go to 80 milligrams. And if the patient was on 80 milligrams, that is the one and only time you would use the 60 milligrams. It is important to note, too, that many of our patients are on statins. And again, the recommendation in those patients is that you limit the dose of statins to a moderate dose, and that is listed in the PDR as to what that would be for each of the medications, but that there's no contraindication in those individuals. It would just be important to make sure that their statin dose is in a moderate range. So the side effect profile of the medication it was found to be very safe in the patient population that received resmetirom. The common side effects that perhaps were higher than in the placebo arm were primarily nausea and diarrhea, so GI side effects. I think it's important to recognize that your patient should be aware of what to expect, and also important to let them know that those side effects tended to subside over time. So the medication overall was tolerated very well and was found to be very safe. So I will thank you very much for your attention. And if you have additional questions, please feel free to go to the GAP website for further information regarding resmetirom, but also other liver-related topics. Thank you.